what are some pros and cons that you've learned so far, and what advice would you give to someone that is looking into something like that?
So, pros and cons. Of course, the pros right now is money. You are truly, I finally feel for the caliber of nursing that I can provide. And for my experience as a nurse, I'm finally getting compensated for
Hmm.
that,
Hmm.
which is sad because it's not a forever thing. It's just, I mean, long term, I can't do this, but
Hmm.
that's definitely a plus. Pros also is you really are refining your skills as a nurse, and so you kind of feel like a badass going in and being like, hey, no, like I can handle this. I can have 1 or 2 days of orientation and be able to kind of throw yourself into craziness depending on your contract.
Hmm.
Cons, it really depends on the contract and place that you're at because a lot of the times these are going to be the hospitals that they need people. So, I
Uh-huh.
mean, you're getting paid that much for a reason.
Yeah.
Yeah, you're going into sometimes just dumpster fires is what we like to call it.
Yep.
And it can be crazy,
And
but you just have to hold on.
you're not going to like UCLA hospital. You're not going into like
No. No. Yeah,
like
no,
the high like the highest the best like hospitals
no.
either, right? You're not going
Yeah,
to the best places or whatever it may be for the most part, right?
absolutely. So I mean, a lot of the times, you have to be kind of quick on your feet, and not every hospital is the same. So I mean, they're going to be different, even down to like technology. Monitors are going to be different.
Mm.
Your supplies are going to be different, and I mean, the way they do things is going to be completely different. So you just kind of got to throw yourself into it and be open to rolling with the punches. A
Mhm.
100%. Um, so that's definitely a con, and so that would be another tip of it, like an advice for anybody who wants to travel, especially like in the NICU world is going to be a lot different too compared to adult world.
Yeah.
Um, and so if you're a NICU nurse and you have a couple years experience under your belt, make sure you have, you're going to go to a NICU that's more of like a level comparable to what you're used to. So whether it's a level 3 or level 4, level 4 is like the highest end of,
Mhm.
acuity. Is what I'm used to. Um, but yeah, and always ask questions. If you don't feel safe, speak
Mhm.
up.
Yeah.
Never, ever, ever stop asking questions, even if you feel like it's dumb. There's no dumb
Mhm.
questions in healthcare.